Welcome to our deep dive. Today, we're going to be looking at some commonly prescribed drugs,
Okay.
specifically the ones that start with the letters M and N.
Right.
We're using a list of the top 200 drugs that was curated by Dr. Khaled Hassan.
Oh, wow.
Yeah. So,
Very cool.
he obviously did a lot of work
Yeah.
to make this list. So,
Yeah. Thanks to Dr. Hassan.
yeah, thanks to him for compiling this list.
It's an interesting area to delve into for sure.
Absolutely. And, this is like getting a peek behind the curtain of the medicine cabinet.
Yeah, I like that.
Right. So let's jump right in.
Okay.
So starting with M, we've got a whole variety, diverse range of drugs here.
Yeah.
We've got everything from Meloxicam,
Okay.
which is also known as Mobic,
Mm-hmm.
all the way to Memantine,
Okay.
which is also known as Namenda.
Gotcha.
Now, Meloxicam is for pain and arthritis.
Okay.
Memantine is for Alzheimer's. And I think it's just fascinating how different these conditions are.
Yeah.
But yet they're both addressed with medication.
Yeah, no, it really highlights how complex the human body is.
Absolutely.
And how medicine has developed these targeted approaches,
Yeah.
For specific ailments.
Right.
But you can also see patterns even within just, the short list that we're talking about today, like
Right.
Meloxicam, Nabumetone, which is also known as Relafen,
Okay.
and Otrexup, which is also known as Aleve, are all NSAOs.
Yeah.
But they each have, their own little subtle differences in how they work and who they're best suited for.
So it's like picking the right tool
Exact.
for the job.
It really is.
Even when you're just talking about pain relievers.
Yeah, that's a great analogy.
So what makes them different? They all seem to work on pain and inflammation.
That's a great question.
Yeah.
They all work by inhibiting something called COX, which is an enzyme that's involved in inflammation. But there are different types of COX.
Oh.
Some NSAIDs are better at inhibiting what's called COX2, which is involved primarily in inflammation.
Gotcha.
While others inhibit both COX1 and COX2.
Okay.
And COX1 plays a role in protecting the stomach lining. So if you inhibit that one, you can have some side effects like ulcers.
Oh, I see.
Yeah.
So some of these are gentler on the stomach.
Exactly. And so doctors are considering all these factors when they're deciding which NSAID to prescribe.
Right.
And then we also have, on this list, Methadone.
Okay.
Or Methadose, which is an opioid that is used for both chronic pain and opioid addiction.
Right.
And so this, kind of brings up this.
Oh, this is some serious stuff.
Yeah. And this brings up a really important issue of balancing the benefits of a medication with its potential risks, right?
Right. So how do doctors sort of walk that tightrope?
Well,
Of keeping patients safe and making sure that these powerful drugs are.
it really involves careful patient selection, careful monitoring, and open communication.
Right.
Opioids, while they can be very effective, they do require this kind of really, careful management because of the risk of dependence.
Okay.
And it's interesting, we also see medications like buprenorphine naloxone.
Okay.
Or Suboxone on this list as well, which are actually specifically designed to help combat opioid addiction.
Wow. So,
So it's kind of like
it's
this push and pull.
Yeah, a constant kind of balancing act, right?
Right, between treating and then treating the treatment.
Exactly.
Yeah, okay, so moving on here. Methotrexate really caught my eye.
Oh, yeah?
Or Otrexup.
Mm-hmm.
Now, this is used for rheumatoid arthritis, psoriasis, and even some cancers.
Wow.
So how can one drug be effective for such different conditions?
Well, that's the beauty of pharmacology.
So Methotrexate, it works by interfering with cell growth and division.
Okay.
So this mechanism is really beneficial in conditions like rheumatoid arthritis and psoriasis, where the immune system is kind of overactive.
Okay.
But it also makes it effective against certain types of cancer, where rapid cell growth is a hallmark.
So understanding how it works
Yeah.
can really show you
Mhm.
how it can be used in different places.
Yeah, you can reveal its potential, across these seemingly unrelated conditions.
Absolutely. Absolutely.
And this, leads to more effective treatments.
Right. Okay.
Yeah.
So then we get to some of the more familiar names,
Yeah.
like Methylphenidate,
Okay.
which most people would know is Concerta or Ritalin.
Mm-hmm.
And this is used for ADHD.
Right.
We also have,
Good old Metronidazole.
yeah, good old Metronidazole or Flagyl,
Yep.
which is prescribed for all kinds of infections.
All sorts of things. Yeah.
Right.
And don't forget nitroglycerin or nitrostat sublingual
Okay.
for angina,
Mm-hmm.
which is, a classic example of a medication that has a really long history and proven effectiveness.
Right.
And we also have Moxifloxacin,
Right.
which is a fluoroquinolone antibiotic,
Right.
and Mupirocin, which is a topical antibacterial.
Okay. So a lot of M drugs.
A lot of M drugs, yeah.
All right. So let's move on to the N's.
All right.
So we come across more NSAIDs here,
Okay.
such as Nabumetone,
Right.
and we've got the combination of buprenorphine naloxone,
Yep. Or Suboxone.
Suboxone, right?
Mhm.
And then we have niacin, which is for cholesterol.
Okay.
We've got nitrofurantoin, which is used for UTIs,
Uh-huh.
and nizatidine, which is for acid reflux.
Yep.
So these are all really
This is,
common health concerns,
absolutely.
and it seems like there's a lot of different
Yeah.
options for treatment.
And each of these medications really requires careful consideration of the individual patient, their needs and any potential interactions with other medications they might be taking.
Of course.
So determining the optimal medication regimen is complex.
It's not simple, yeah.
Yeah, there's a lot of
A
them.
lot of factors involved.
Absolutely.
Okay, and then we have nortriptyline,
Okay.
which is a tricyclic antidepressant,
Uh-huh.
but also used for chronic pain.
Right.
So again, this idea that
Yeah, and
one medication can be used
this is a recurring theme.
in a bunch of different
Absolutely. And, nortriptyline's effectiveness for both, depression and chronic pain
Mhm.
is really linked to its impact on neurotransmitters in the brain.
Oh, interesting.
So it really, speaks to this, evolving understanding
Yeah.
of how our bodies work and how medications can, impact different systems.
Right.
And it really reinforces the need for those personalized treatment plans.
So it's been quite a journey
It has.
just going through these M&N drugs.
I know. It's amazing how many there are
Right.
just within those two letters.
Yeah, and we've really only just scratched the surface here.
Yeah. I mean, this is, just a tiny fraction of all the medications that are out there.
It's the top 200, yeah.
But it's a real testament to, the ingenuity of medical science and the constant pursuit of better treatments.
Absolutely.
And, this list really is a great springboard, I think,
Yeah,
for anyone who wants to, understand their medications better.
absolutely. And knowledge is power
Yes.
when it comes to your health.
Absolutely.
So, if you're ever prescribed one of these medications,
Yeah.
don't hesitate to ask your doctor.
Yeah.
Your
Or
pharmacist.
pharmacist.
Any
Yeah.
questions you might have?
Keep that curiosity alive.
Yeah, absolutely.
The more you understand, the more informed those decisions that you can make about your own well-being will be. Decisions that you can make about your own well-being will be.
Absolutely.
Yeah.
Okay, well, this has been great. Thanks.
It's been fun. Thanks for having me.
All right, see ya.
See ya.